Lisa Brown from the State Department of Commerce, and Dr. Brown, along with Chris Green from her office, will be talking about the Commerce report. So we will get to that after we get through our dashboards and health officer update. And then anything that we want to add into open discussion, we can. Does anyone have any questions or topics we need to make sure we cover? All right, well, the data was sent out. It was updated in the meeting invite. So everyone has that, and Steve can kick it off here.
Great. Good morning, everybody. So data for the prior week, so October 11th through 17th, we had 654 new cases, which is an increase, putting our daily average at about 93. For the 2-week total, so October 4th through 17th, that was 1,243 cases. The prior 2 weeks, so that was September 20th to October 3rd, was 1,147, so up about 100 cases for the 2-week period. Age groups, it tends to be pretty much the same. 20 to 29-year-olds are about 22%. There's a slight increase in 40 to 49-year-olds, so we're making up 15% of the cases. In terms of our rate per 100,000 of newly diagnosed cases, it is 241, which was an increase from 223 from the prior 2 weeks. The heavy link is at 78.3%, increasing just a little bit. For the prior week, we had 21 new hospitalizations, or 25 the previous week. Currently hospitalized in Spokane, so that's Spokane residents and non-residents, is 53, which is a slight increase. And for Spokane residents hospitalized, that's 37 currently hospitalized. In the prior week, we had 5 new deaths, which matches the previous week. Individuals in their 60s, 80s, and 90s. Testing has gone up. The average number of individuals tested rate per 100,000 was 172.3. That's up from 159.9. Our percent positive is about 10.3%, so steady. We've been somewhere between 9.5% and 11% for the past number of studies. For our percent of licensed beds occupied by patients, we are at 63.2%. That's all beds. Number occupied by COVID or confirmed or suspected is 53, which means about 3.3% of beds are occupied by confirmed or suspected COVID-19 cases. Our casing contact tracing metrics, we investigated internally 484 cases. Reaching within 24 hours, we had 62%. Contacts reached within 48 hours was 84%. The Care Coordination Branch continues to see households for needs. To date, they've reached 646 households. There are currently 119 cases open. They closed 41 last week. The trends in service are financial assistance, needs for food, and needs for PPE or cleaning supplies. Our business technical advisors are still working with the community. Total consultations over time have reached 2,145. In the prior week, they completed 162 consultations. Food security has maintained fairly steady. New applications have gone up just a little bit between October 5th and October 9th. Our latest data, there were 626 new applications for food assistance. And child care remains pretty much the same, only an increase of 11 vacancies. For unemployment insurance claims, it's gone up quite a bit from October 4th to October 10th, so 1,375 claims for unemployment insurance. That is up from 854 the prior week. Industries impacted the most are food services and drinking places, administrative and support services, and specialty trade contractors. And finally, for the outbreak reporting, the number of outbreaks in long-term care facilities, there are currently 17 active. There have been 43 over time, which accounts for 4 new facilities of long-term care. For the prior week, there were 14 total new outbreaks, long-term care being the highest one with 4, service industry with 3, goods producing industries, which can include things like construction, manufacturing, food, was 3, one in healthcare, one in government, and then two in what we just call community settings. And that concludes my report.
All right, any questions for Steve related to the data?
There's issue with audio.
Can they hear me?
You're gonna have to yell really loud. It's coming off of, everything's coming through here, not through there.
Oh, okay. So I can come up closer to here. So any questions for Steve?
Amelia, we can hear you just fine when you say.
Oh, you can hear me, just Steve. Okay.
It got better. It was only right at the beginning.
Okay.
Like the first sentences or so.
Oh, okay. All right. Perfect. Thank you, Alicia. Any questions? All right, Dr. Lutz, any?
Yeah. Good morning, all. Yeah, the last couple of weeks I've had the opportunity of being on two webinars. One was coordinated between University of Washington and Johns Hopkins, and the other was the National Academies of Medicine, Science, and Engineering. Those were which featured Dr. Fauci. Yesterday's conference was just brilliant with the conversations around where we are, where we've been, where we are, where we're going. And also just looking at it from a global standpoint, just again, really very interesting, very intriguing. A couple of just comments from his conversation yesterday. You know, right now, if you look at us nationally and even at the state level, we're at what we are sort of seeing as our third wave. And this third wave is a little bit different than the first wave, somewhat more similar to the second wave in that it is being driven by younger people, fewer hospitalizations, but one of the things he pointed out, which I think is really very important to realize, is that 40% of Americans have comorbidities. They have medical conditions that put them at risk for hospitalizations. So yesterday I signed off on a death report of a 56-year-old and another death certificate of a 59-year-old. And, you know, these are young people by my definition, but young people, again, have comorbidities that put them at risk. And so that's something that I think we really have to consider with how we're moving forward. You may have seen some interesting rhetoric around a new proposal calling for a push towards herd immunity. It came out from a number of very well-respected academicians, but it's a bad argument. It really, again, has a lot of holes that can be punched in it. But again, unfortunately, that's part of the rhetoric right now, that we should be pushing for herd immunity and just let people go on and live their lives, those who are at low risk. How do you do that? I mean, you put people who are at low risk in, or I should say, put people who are at high risk in bubbles, and just allow everybody else to function. So again, I think that's an unfortunate rhetoric that's right now sort of dominating some of the discourse. We're all dealing with pandemic fatigue, and I think that's one of the biggest issues that we're dealing with nationally as well as statewide and locally. It's everywhere, and you know, people want to get on with their lives, but unfortunately it's not necessarily practical or realistic at this time. Interesting, the Sturgis bike rally, where maybe 460,000 people attended. It's believed that's probably driving much of the outbreaks in the Midwest. North Dakota and South Dakota have some of the highest rates right now. That's where disproportionately the numbers of people came from, also Minnesota, Wisconsin, Iowa, and you're seeing significant increased cases as well as hospitalizations and deaths in those states. A lot of conversation about vaccine. And, you know, Dr. Fauci, cautiously optimistic, as he said many times. The best data, he believes, will be available probably late November, early December, which may show that the two vaccines that are sort of the front runners right now may be effective. Probably the most realistic time frame for vaccines being available would be, late December, early January. Again, in very limited amounts, that's sort of what the state is talking about. But realistically speaking, you're also not looking at sort of, if you will, mass vaccinations available throughout the state and the country until late spring at the best. So it's a lot of pent-up demand for the vaccine, is that the vaccine is going to be the way to move forward. The reality is that the best way to move forward is with the public health recommendations that have been in place, and that really will be sort of in place for quite some time. It's the physical distancing, it's the face coverings, it's the hand washing, all the things that have been shown to work. The vaccine is not going to be the silver bullet, so to speak. There's no treatments out there right now on the horizon. It really is just more of the same. And so how do we get through the challenges that we're all dealing with right now, realizing that, to be realistic, what we're doing is what we need to be doing with respect to the public health recommendations. As was said by one of the individuals, the effectiveness of any vaccine is proportional to the effectiveness of public health response. And so I think it just really speaks to the fact that collectively we all need to be supporting this work, albeit acknowledging that it's not easy, it's not always something that we get a lot of credit for, but it's really something that's essential if we're going to move forward. Questions? Doug, do you have a joke for that? I mean, since we're going to go on, on stage, I need a little lightness after me.
I just wanted to know, is it okay if I call you Dr. Besky?
Is there a joke there? I'm not from...
Bessie is like, it's like best friend.
Thanks for
Grandma.
Okay. Sure, yes you can, Doug. That's great, thank you. I now that I have the interpretation.
Yeah. I'll go on the road.
If you need me to program your remote control or your VCR, I can come over.
It's like seeing your BFF.
I have a Betamax, Doug. Do you have one of those? I have an 8-track as well.
One thing I did want to add, looking at the data and listening to Dr. Lutz, at the next meeting on November 3rd, I've asked Kelly Hawkins to come in and update us on the campaign that we're doing focused on the 20 to 29-year-olds. She's starting to pull, she's got data that shows the number of times different things have been watched and accessed, and I thought this group might appreciate an update related to that. Other question? Oh, Katie, it looks like Katie has a question.
Yeah, so for those of us that have not lived in the public health world ever before, could you kind of walk us through the last time our nation went through an immunization dispensary process? Kind of just, is it through your doctor? Is it through the county health department? Is it from my local pharmacy? How do you think that it will play out so that the people that need the virus first get it and the rest of us can follow? I'm just kind of curious. I grew up in the era when we got immunized in the school system.
Yeah.
And I just want to have a question about how that usually rolls out.
So we're actually, we have staff right now that are assigned to vaccination planning, Katie, to start, trying to figure out some of those things, what it looks like and how it will come out. We still have a lot of unanswered questions, but I think as we know more, we'll bring it to this group for, figuring it out. But like Dr. Lutz mentioned, we're still always out on having a vaccine. So, we're trying to do initial planning behind the scene, but, we don't have dates or things like that. So, we're just trying to do the initial stuff.
Katie, to your point,
I'm not looking at the
No.
I was just curious if the city, if municipal government will play a role, if it's going to be more through county health, our doctors, our pharmacies, the hospitals, who's going to be kind of leading that charge and organizing it? and then keeping track of who's immunized and who's not.
Okay, I guess my comment would be yes, 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 and yes.
Okay?
I mean, I think all of those players are going to have roles. As Amelia said, there is a statewide effort on looking at what a plan of distribution would look like. Certainly, you're going to be seeing it at providers. So for example, right now, with the rollout of flu vaccines, there was some concern mentioned a couple of weeks ago that there were limits on the amount of flu vaccine actually available. There are limits only in that they want to ensure that every provider has access to some vaccine. So rather than one provider getting all of it, one community getting all of it, they're sort of doling it out proportionally. And so that's what you will see with respect to how the COVID-19 vaccine comes out. And then again, public health will have a role, as will hospitals, healthcare organizations, and then obviously working very closely with municipalities so that we are able to identify those high-risk populations as identified by the Department of Health using the National Academies of Medicine guidance and CDC guidance. So as Amelia said, a lot of planning. We have people who literally are on calls every week looking at the process. But again, it's, months in coming.
Yeah, no, and I appreciate that. One of the things that I would just like to weigh in on is whatever the process is, the timeline is, the clarity of the communication to our communities in Spokane County is going to be so important because there's so much confusion out there. I think that when it does become available, we don't want people fighting or arguing or falling over each other, trying to get a first place in line, so to speak. So I think that communication of what the rollout looks like and how someone gets information and makes appointments and all that, I just think the communication piece is going to be huge.
Yeah, and they're in the planning for the vaccination planning for the plan is communication planning. That will all be part of it.
Thank you.
Yep. Other questions? Okay, well, I will, is there? Okay, Alicia, I will segue over to you for GSI, and then also if you want to introduce our guest.
Great, good morning, everybody. Thanks, Amelia. I don't think we have a ton of updates from GSI, but I really want to give the time. I want to thank Lisa and Chris for being here today. I think from the conversations that we've been having over the last weeks of certainly this group and many other conversations as we continue to struggle with, getting our arms around the pandemic. We also have this mounting economic crisis, and so the Department of Commerce has been key in that work. And really important to the role certainly that GSI as the ADO and many others across the state play. And so they've also recently rolled out an economic recovery dashboards and some tools and things that are really helpful as we think about both the shorter term and longer term. And so I want to give most of our time to them. I think the only thing I just want to keep this group apprised of is that especially, this has been an ongoing, but the impacts on the hospitality sector, both as they continue to be the highest unemployed, as well as just restrictions as far as phases. We're having a regional conversation about what additional supports might the hospitality sector need as we head into the fall and winter. And is there some additional relief that we can get to them and some of those kinds of things. And it's just, I think the frustrations are just continuing to mount, particularly for those sectors that are stuck in phase 3 and 4 or very limited capacity in phase 2. And so, and not seeing light at the end of the tunnel because we know that where our case counts, et cetera, are growing. So there's been a great conversation going on, including the Washington Hospitality Association and our local partners trying to think about what we do creatively together in Spokane County to support kind of the broad scheme of businesses still caught in that sector. So more to come on that, but I just want to make sure I keep people advised on that front and happy to answer questions. But other than that, what I want to do is hand it over to Lisa and Chris. Thank you both so much for being here, and would just love for you to be able to give this group kind of a status as far as what's happening with the Department of Commerce and how we think about the economic recovery and crisis, etc. So Lisa, over to you.
Yeah, thank you, Alicia, and also thank you for GSI being such a great partner as we've been going through, especially our first round of business assistance with state dollars that had certain requirements attached, and you've just been really great in helping us really get those resources out to them. And for everybody on this call, just echo, yes, there is a bit of some of us are getting pretty worn out by the virus response, but thank you for the work that you're doing and coming together, getting information, asking the questions, and making plans. I actually have been part of a similar group at the state level, the UCG, with the Emergency Military Department and the Governor's Office and a few cabinet members that have been meeting 3 times a week, although sometimes every day and sometimes on the weekend, as you know, since the pandemic began in March. And we've done virus, then virus plus civil unrest, then virus plus fires, then virus plus national security, cybersecurity issues. And so now we're just back to virus again. So the kind of planning that Dr. Love referenced and the questions that you asked about vaccine planning, this group also takes on reports on what is the plan for distributing the vaccine, assuming, of course, that it'll be in limited supply. First of all, we have to prioritize the population that really need it and come up with a fair distribution plan so that it can be distributed statewide and to those priority populations. And they're taking a lot of input on that planning, and I know that people from Spokane County are participating. So that's really important. At Commerce, I've got my Assistant Director, Chris Green, with me. We've been engaged in our regular Commerce activity, with 90-some programs that we normally carry out, but also a lot of emergency response and CARES Act distribution. And we're also engaged in recovery, economic recovery tracking and planning. And Chris is going to give you a demonstration in a couple of minutes of our economic recovery dashboard. And our goal is to both track and help policymakers do appropriate policy so that as we move through the pandemic and into recovery, we understand what's happening sector by sector in Washington State and what's happening region by region down to the county level. And we think that is really important so that we don't just look at the big picture numbers for Washington State and say, hey, we're back on track with employment, when we know that there will be particular regions and sectors that are very hard hit, as I mentioned, hospitality and performing arts, et cetera, right now, with really no end in sight for them. And then there are also certain sectors that actually have a lot of economic activity and even investment happening. And we'll get a little bit of a picture of that as Chris and I go through the dashboard. And then ultimately, as we move into recovery, state policy will be advocating at the Commerce level for a couple of things we see as sort of key infrastructure for business and families, and that would be broadband and childcare. Those being really important both for employers and for families. And then also the other types of tools that the state has, like an infrastructure package that it could pass through the transportation budget or the capital budget. And we're particularly focused, again, on sectors and regions. In other words, helping to build clusters economic activity in different parts of the state. Spokane County has clusters already in aerospace, life sciences, tech, wood products. Those are the kinds of things that our sector leads that work for Chris are looking at across the state and trying to understand both the challenges and opportunities and give appropriate feedback to policymakers. So Chris, why don't you take it away with the screen and show the dashboard? And this is publicly available on our website and updated regularly, and we're also looking at other things we may want to add to it. We got a lot of assistance from other state agencies who have helped us with the data, from Employment Security Department to the Department of Revenue, DSHS, and our game plan is to keep it going, keep it responsive to the kinds of things that policymakers want to know about, and to hopefully have it be a tool that is useful for our economic development partners like GSI and ports across the state and economic development organizations. So Chris, want to give us an introduction to it?
Yeah, hey, thanks a lot, Lisa. Can you all hear me okay? Okay. Well, as Lisa mentioned, this was, the purpose of this was to have, good data to both make good policy decisions, but also to track over the next several years how the recovery is going. And we've got a few different kinds of data here. So we do have some traditional data that I'll show you that some folks might be interested in looking at in and around employment. And so we've got, thanks to our partners at the Employment Security Department, we've been able to access some of the unemployment and employment data that they have. Let's see if my computer will go. Oh, there we go. So as Lisa mentioned, this data, I believe, is through the end of July at this point. So we update this about monthly. And in this case, you can see, if I go over to the far right side here, this is the percent change in the last time period. If I go over to the far right side and just resort the categories, you can see leisure and hospitality has not only had the most total number of jobs, 96,000, but the largest percent decrease in their industry. So without a doubt, it matches our understanding of the companies we talk to and the difficulty they've been having this year. There's been a lot of challenges there. Also, just to point out, manufacturing still is down quite a bit. And a lot of that, some of that is related to the commercial aerospace supply chain. We know there are more adjustments coming in that category. So this will be a number we're going to want to watch very closely. I think the most compelling thing here is just that all of these numbers are negative. And if you were to go to over on the side, you can toggle and look at some different time periods. If you were to go look at some different time periods, let's say if you wanted to go from 2003 to how about 2006, it's the opposite story. You could look at a lot of these categories and see growth. And so there's an ability both to look at what's going on right now and to compare over time how we're tracking and how we're doing on the recovery. So here, this is a slide, and by the way, as Lisa mentioned, this is all available on our website. You don't need a special password. You can just go to commerce.wa.gov and you can access and do all the functions that I'm doing here. Here you can see unemployment claims. You see the big spike in March.
I think you kind of froze.
Yeah,
Chris.
I think you froze.
So
We're still
he's
not
back.
quite back to where we were.
You froze for a minute, Chris.
Oh, you know what? Let me try to turn off my VPN. Okay, maybe that'll be better. So I was just mentioning some of the unemployment claims here, where you see the big spike in the early part of COVID and then reducing quite a bit, but still not quite back to these baseline levels from earlier in the year. One other thing we've built into this dashboard, and not on all of these, but in some of them, is the ability to compare other states. And so you can see right here, we're right now to Idaho, Oregon, California, and the greater United States for this overall employment. So this is not unemployment, but just overall employment. And we wanted an ability to see how Washington is doing compared to some other places. And you can even add a state here or there, or all of them if you'd like to add that into the analysis. This also has the ability to change the time series function here too, if you'd like. So interesting, everybody has different pathways through the COVID recession with various, safe start or closure or governor proclamations. And you can see some bumpiness. It's not just a quick, steady incline, although Washington in the red here seems to be continuing slowly on an upward progression, not quite back to where we were pre-COVID. And let me go to show a couple of other business views really quickly. So we wanted to also have an ability to look at business income by industry. And we were able to work out some items with the State Department of Revenue. But as you can see here, again, you've got sort of the total volume of income in some of these industries. You've got the percent change in this time period, which is 1 month ending in July. You've got the percentage change in that industry. So if I resort here, you begin to see, again, leisure and hospitality severely impacted. But if you look at total dollars reduced in income by an industry, manufacturing is very significant. And so again, a lot has to do with transportation and aviation, but that's a quite stark number to be looking at. I will say, if you look down at some industries, of course, all these ones that are still in negative here provide some concern. And the fact that some are beginning to see some positive growth is very interesting. 2 months ago, when we were looking at this data, these were all the numbers in the percent. Let's see. I think I'll just show a couple more things. I think, international trade is very important, obviously, to the state. So we want to be able to, over time, track what is going on with the big trade and export markets for our state. This similarly works the same way. You can see total dollar volume of trade, the change in dollar volume, and the percent change in any of these industries. No surprise that aerospace continues to have some issues. You can also look at this over in a time series. I've got it selected here, defaulted to aerospace, agriculture, and then all other trade. You can deselect and choose some other categories, but you can see we're a little bumpy and we're still not quite back to where we ought to be, although some positive news in agriculture in that their decline or the reduction year over year hasn't been as stark as some other states that are more heavily dependent on the ag trade. So we're working closely with the Department of Agriculture to understand what opportunities we have to be helpful there. We added some data here. This is about trying to understand what kind of investment continues to come to our state. And this probably is not the best indicator of whether or not the state is recovering from the COVID recession, but it is an indicator of whether or not our state is still interesting to invest in, or whether or not we're still competitive in attracting investment. So we've got an ability here through one source to look at a variety of deals that have been publicized, filed with the SEC or through some other means, to understand what kind of sectors are being invested in. So this goes all the way through Q3 of 2020. No surprise, in the dark gray, that information technology continues to be a big chunk. And at different quarters, you can see the breakdown of these industries, which has a greater share of whether or not where there is investment being made. You can also change the graph here to, instead of showing, I should select all these. Well, we may not have all the data in here for all of this. So you've also got an ability here to look at the type of data. So usually we've got venture capital data would be the purple, but there would be usually some other colors here in green for mergers, acquisitions, or blue private equity. So I'll have to check this data source and see if the colors got jammed up. I don't think we have exclusively venture capital. Usually we've got a better distribution of some of the other kinds of investment data. Okay, and maybe one more on support programs. So we're hoping to do something a little bit different with this dashboard. We think all those basic economic data points are interesting. I think they're good indicators for us to understand the performance of the economy over time. And over the next few years, I think they'll be helpful in how we create some policy. However, it doesn't tell the full story. As we know, GDP is a good indicator, but it hides a lot of other information, and it really hides how are individuals doing. And so this is a time series graph of how many folks are accessing the basic food program through Washington State Department of Social and Health Services. As you can see, you had some declines and fewer people accessing that program, and then big spikes. So the challenge is this many more people had a financial difficulty or were not financially self-sufficient, had to access the state program. And we can do the same thing for the TANF program as well, where you see many more individuals across the state having to change their resource income list and look at some other resources because either jobs dried up or incomes were not sufficient. So this is one way for us to understand what that nexus is of the folks that live on or near the poverty line, and whether or not the economy is really working for everybody in Washington. We all know, because we watch this stuff, that it isn't. But over time, hopefully, we'll be able to look to some of these numbers and track and understand where's that intersection, where do we make an impact, how do we ensure that the economy can work for all folks. Last thing I'll say, and I'll turn it back over to Director Brown, is I think, and you all please, go to this and check it out. And if you have questions, please feel free to reach out. We've got some plans moving forward to add to this. I think I didn't go through all of the view charts here, but we're interested in a few additional things, like some way we might be able to really dig more into that intersection of poverty in the economy, and things like housing security or individual income levels. So we're just now getting to a phase where we might start incorporating some new data sets. Probably the data sets that we'll incorporate are more quarterly or annually. From here on out, the data we have here is weekly or monthly. So we'll have to change our rhythm a little bit. But also things like workforce skills and workforce job placements in particular industries, and workforce training programs that might be in demand based on different data we might be able to gather. I think those are some other things too that we think we want to add over time. And the last thing I think we're close to being able to pull together is some more specific industry data. So on some of the revenue charts earlier I showed you, you can see a breakdown by manufacturing or leisure and hospitality. We also know, as Director Brown mentioned, that we're interested in sector-based economic development across the state. So we have really nailed down and drilled down in our own NAICS codes to pull out things like life sciences and commercial aerospace and clean technology, and some of those categories that don't naturally land on one of the other breakdowns, to understand how we're going to support some of those industries on a more focused way. So let me stop there. I hand it back to Director Brown. Happy to answer any questions.
Hey, Chris, why don't you go ahead and show like the Spokane County breakdown, since we can do it by county as well.
Yeah. So this is the dashboard level. So on the front end, you can click on any one of these counties and just see some numbers just for that county if you just want a quick view. And so not all data is available at the county level, of course, but for some of these things, you can see some of these highlight numbers. If I were to go into, let's see, I think employment, we can go county by county and pull down, and maybe we can do a map view here. So there's map views available on some of these, and so you can go and isolate a county and understand not only what the number is for the current time period, but how we arrived at that number. Very interesting with Spokane County here and Adams County here. I know we know of a couple of projects that have happened there that were really great projects. I'm half wondering if it really could have turned the dial that much for them, but I know they were pretty big projects that county had that were historic for them.
Yeah, thanks. And so we're happy to answer any questions. When it comes to the CARES Act dollars, we've been, the biggest piece for us has been our local government support. So that goes through commerce contracts with counties and cities and towns. Also, rental assistance. We have a $100 million rental assistance program happening right now, and business assistance and nonprofits. So, and both on the business side and the nonprofit side, we are also trying to take an equity perspective and really look at groups, Black entrepreneurs, Asian small businesses, et cetera, that have been historically underrepresented, haven't had the same access to capital. And so we've got a kind of a parallel piece of work going on where we contract with organizations like AHANA in Spokane or the Tri-Cities Hispanic Business Council to do more outreach, language and culturally appropriate technical assistance. And as we go into the legislative on the operating side of the budget, but once again, we want to have our ADO funding to organizations like GSI funded sustainably and not taken out of our strategic reserve fund, which, as you know, is a tool that we have to work on a county by county, ADO by ADO basis to put some incentives and assistance in place when a company is looking to either expand or relocate to Washington, or we're trying to make sure they don't relocate out of Washington. And because the tools in our toolbox are not as many as other states, we really want to hold on to the ones we've got and potentially expand them. So that will be part of our policy work. And we also just received a $15 million EDA grant, and that is going to give us the ability to do more of this focused sector by sector work. So Chris and his team we're doing conversations across the state with CEOs in different arenas like tech and wood products, trying to understand what they think some of the options are and where we either need critical infrastructure or state investments could be helpful in securing that type of activity. And there really are, surprisingly though, because you mostly hear the bad news, there's really some good things happening too. There are still a lot of calls coming in, and there are some success stories like the recent announcement about Violet Power in Moses Lake doing solar, integrated solar manufacturing facility. And those are the kinds of things we want to both be on top of and continue to work with our regional economic partners on. So happy to take any questions or comments. Looks like there's a question up there.
Director Brown, as more government agencies are starting to submit their requests for funding through the CRF, their requests for reimbursement, are there any trends you're seeing, any issues that are coming up? I notice I'm getting some surveys now from Commerce that I hadn't received before that leads me to believe maybe there's something of some concern that's arising. Do you see anything?
Well, what we're really trying to do is, well, there's kind of two things going on. One, because it is such a decentralized process, right, with funding streams going to the big five, 4 counties in Seattle, as well as the funding that goes through Commerce. We're trying to gather some of that information just so we can say to the legislature, here's what matters at the local level. Here's what they're spending their money on. The other piece of this is we're trying to get a handle, as you know, like right now, the deadline is the dollars have to be out the door by December 31st. We are we very much would like to see another stimulus package. I think we all know that's kind of hanging in the balance right now as we speak. Not only do we want another stimulus package for obvious reasons that things could really come to a head with the end of the unemployment assistance and still being in this pandemic recession. But we're also hoping for some flexibility in the deadlines on those dollars. But right now, they have to be spent by December 31st. So we're kind of in this balancing act to figure out what local governments either have spent or are planning to spend. If there is any surplus, we don't want to send that back to the federal government. We want to redeploy it, and so trying to understand what that might look like. And it's very challenging to redeploy it in a smart and fair way, as well as by the deadline. For example, people are saying, what about some assistance for landlords? And we totally sympathize with the situation that many landlords are in with eviction moratorium. And if their tenants apply for rental assistance, that's one thing. If they don't, they could really be in a difficult situation. So could we do a landlord assistance program? How could we do it fairly? And who could we partner with to get those funds out? Could we do more small business? We're discussing with the governor's office the possibility of some kind of recovery fund that we could potentially utilize some CARES Act dollars for and push them into the next year in partnership with private capital for more equity for small businesses. So it's kind of coming down to the wire here on that. And that's the reason we're asking for that information. We really like the feedback from you. Where do you see the need so that we can communicate that to the governor and the state legislature?
Do you see the deadline for municipalities being pushed back? I mean, we're at November 30th, and the problem with that is trying to get people utility money and not be right back, have them be right back on our shut-off list come, January 31st because we got them the money too early. So any thought about that?
So now I'll take off my commerce hat and put on my former Senate Majority Leader hat. I think there will be an agreement. I believe the most likely occurrence is there's an agreement right around the time the new Supreme Court justice is sworn in. That would be one time. Another possibility would be in the lame duck session. And if they do an agreement, I believe they will move the deadline, potentially give some flexibility there. But we can't just count on that. You can't count on that. So for the time being, we're just trying to deploy the resources by the current deadline. That is the goal, and assess what's left and make game plans. And if that flexibility does occur, I think everybody will breathe a sigh of relief, but it won't be the end of the story, because it also means we're trying to, as you said, figure out really how to do that. So, for example, can we use some of these local assistance dollars with water PUDs? We were just talking about this in our leadership meeting yesterday, so that they can then have relief for people who haven't been able to pay their water bills in those rural PUD communities. So those are basically we're in that waiting game to see if we get the flexibility.
I just want to say thank you to Lisa and Chris for joining us this morning. And I hope this was helpful for folks as we look at both the short-term and the long-term view. I know the dashboard and just some of the tools, as well as certainly all of the work that Lisa and Chris's teams are doing every day, is really important for the work that GSI and our other partners are doing across the region and across the state. So just a huge thanks to both of you for being here this morning. And if folks have questions after the fact, happy to make sure you're connected to Lisa and Chris or anything else that's going on.
Yeah, absolutely. Happy to do that. And this is actually my first trip back to Olympia since, and our office will be closed. Our offices will be closed through the end of the year. But we had a bit of a hybrid leadership meeting yesterday, and I brought presents from Atticus and Boo Radley's to people on the team. So support your local small businesses, I guess, would be my final message. And thank you, everyone, for giving us the opportunity.
Thanks, Lisa. Thanks, everybody.
Thank you. Okay, anything else for the recovery committee?
Amelia, this is Arian. I just had a quick thing that has to do with commerce that I wanted to share. Allison Polson, the director of Better Health Together and the Accountability Community of Health for the 6-county region, has been partnering with commerce with funding. Russ Elliott, they're working on the broadband survey assessment and potential funding options. And so I'm going to include at the bottom of the notes a link to a commerce website that will allow you to share with citizens a very brief 1-minute survey for them to indicate through their computer what their broadband capacity is. And from that, there's an amazing, robust map that's being built using utilities, using census data, using planning, that they're really looking at gaps both in the urban core and in the urban-rural intersect. And then at in our area, the 5 counties that are definitely more rural than urban, as far as garnering not only state, but additional federal dollars. So we're really hoping that this effort will infuse telehealth, behavioral health, workforce dollars, quality virtual education dollars. So just wanted you guys to be aware of that, because it is definitely converging over a number of different sectors. And Spokane County is really unique, I would say, is that the leadership of Spokane County actually has influence over the 5 counties around it, because they operate as the Behavioral Health Administrative Service Organization. And so just the overture of urban outreach to the rural partners is being really well received and could attract dollars to us that that we might not have otherwise. So a lot of just very infantile gathering. The group is really trying to have any package available for when opportunities come through the feds or additional money through the state. But I wanted to make sure you knew why that link was going to be included on the notes.
Thank you, Arian. That'll be great for if we can support that and fill out that quick survey. Thank you for sharing that. Rich, any other questions? Looking in the chat. Don't see any. Okay, well, looks like our next meeting will be November 3rd. Can't believe it's already November, at 8 o'clock. And I'll have Kelly Hawkins to present on the 20 to 29-year-old campaign. And if anyone has any other topics they want to send my way for the agenda, please do so. And I think we're good to adjourn.
Thank you.